Hey there, this is Alan McGirl with McGirl Insurance, your Medicare broker. I've been in the business for almost 31 years and I've been helping people bridge the gap to Medicare. Today we're going to talk about the ABCs and Ds of Medicare. We're going to go through a few slides. You're going to end up finding out where you are today in your Medicare choices, and we're going to be able to help guide you through that. So we're going to talk about what is Medicare, how to qualify for Medicare, the different parts, as we said, enrolling in A and B, why the need for extra coverage, and all the different additional coverages, and we'll do a little homework assignment for you to kind of figure out what's going to work best for you. So what is Medicare? Medicare is a federal funded program, health insurance program for people 65 and older. And some people under 65 have disabilities and they will qualify also, such as people with end-stage renal disease. Did you know, as of today, 11,200 people are turning 65 every day? So as of 2024, there's over 66 million American members with Medicare. Now let's talk about a little brief history. In 1965, President Lyndon Johnson signed in the health care bill, which began and allowed 19 million Americans to have Medicare insurance. In 1972, President Nixon expanded coverage for long-term disabilities and end-stage renal disease. Well, in 1980, the ominous Reconciliation Act expanded home health care services and brought Medicare supplements or Medigap policies under federal oversight. In 1997, we came out with Medicare Part C. Those are those Medicare Advantage plans, those HMOs and PPO plans that you've come to understand and realize. That's with President Bill Clinton. In 2003, President Bush, he signed into law the Medicare Prescription Drug Program and had the Modernization Act adding prescription drug plans to your Medicare plans. And that went into effect in 2006. In 2010, the Patient Protection and Affordability Care Act included reform to contain costs. It also closed the Part D gap, which happened in 2020. And then in 2022, the Inflation Reduction Act passed. And what that happened in 2025, they put a cap on your max you'll pay for your Medicare Part D prescription drugs. So who qualifies for Medicare? Well, people turning 65 is probably the most common way. If you're turning 65, you're going to have the ability to get Medicare, and we'll teach you some of that information. You're going to need 40 quarters of credit, meaning you're going to have to pay in FICA taxes for at least 40 quarters. People with disabilities. So if you're disabled for more than 24 months, you'll generally get a Medicare card. And then qualifying illnesses like Lou Gehrig's disease, end-stage renal disease, kidney transplants, those types of situations, you could qualify within 30 to 60 days. The different parts of Medicare. Now, there's only really 4 parts to Medicare. We're going to get into those. There's the original Medicare card, your A and B, Medicare Part A and Part B. Then there's 2 other parts, Part C and Part D, which is the Medicare Advantage plans, along with the Medicare Part D prescription drug plans. Now, the Part A and Part B is a red, white, and blue card, aka your original Medicare. That's where you start, and then we get into the plans. Which plan am I going to take once I have Medicare A and B? Those plans are administered by private insurance companies, and they have a contract with CMS, which is the Center for Medicare and Medicaid Services, and it's renewed every year. In addition to that, there are other options, and we're going to come and have a look at those. But to start, Part A is your original Medicare. Part A covers hospitalization. Think about it as anytime you're going to stay the night. Okay, if I'm going to stay the night somewhere, that's going to be an inpatient care, inpatient mental care, skilled nursing facility, hospice care, some blood transfusions. But here's some facts. You can go to any qualified hospital anywhere in the United States as long as they take Medicare. You cannot go to any hospital outside of the United States because Medicare is only for inside the United States. But you cannot be turned down because of your medical history or pre-existing condition. All right, So moving forward on that, Part A, you got to pay into Medicare for at least 40 quarters. Your deductible, if I only had Medicare Part A and was hospitalized, I would pay $1,736 for the first 60 days. After that, I will have no co-insurance, so I'll just be responsible for that deductible. And then from 61 to 90 days, I'll pay $434 per day. Okay. And then after that, from 91 to 150 days, I'll pay $868 per day for that benefit. So when we talk about, well, that's a lot of money. Yeah, that's why when we talk about Medicare and having your package, we want to give you the right plan that you're not going to have to go and not be able to afford the actual insurance or the copay. So we're going to figure that out. If you paid less than 30 quarters, you will pay a Part A premium of $565 a month. And if you paid into quarterlies 30 to 39, you'll pay $311 per month. Now, some people say, well, I wasn't working, I was taking care of the kids. And that's okay, because if you're married, paying, filing jointly, you can use your spouse's income and file that way also. So you could add up to your 40 quarters. All right, so then we have Part B. Part B is the doctor visits, okay? So whenever I think about doctor visits or Part B, I think about, well, it's the same day. I'm generally gonna go home the same day. So I think about doctor visits, outpatient services, ambulance, emergency room, chemotherapy, oxygen, wheelchairs, and any preventative care. Now, for Medicare Part B, some fun facts is you cannot be turned down because of your health. You can see any provider in the United States as long as they take Medicare. You cannot be declined or delayed. Not a good idea to decline your coverage unless you have credible coverage, which we're going to talk about here. If you delay or decline your Part B and you have no other credible coverage, which we're going to discuss later, you may pay a 10% penalty for every 12 months that you miss. So we do not want to miss any of that. However, if you have coverage through an employer or a group health plan or some sort, which is considered credible coverage, you may not have a penalty, and we're going to get into that too. Okay. Now, there is a premium for Part B. There is no premium for Part A if you worked and paid FICA taxes for 10 years or 40 quarters. Now, for Part B in 2026, your Medicare premium is going to be $202.90 per month. Now, that's only if you made a certain amount of money. Now, what they're going to do to figure out how much you're going to pay is they're going to look at your 2024 taxes for 2026. So really, they look back 2 years. Okay, so they're going to look at your 2024 taxes, and they're going to look at your modified adjusted gross income. So if my modified adjusted gross income is less than $109,000 or $218,000 if I file jointly, then my premium is going to be $202.90. That means I'm not going to pay any extra. Now, let's say that I had a really good year, or I sold my business, or I sold a home, or rental property, or investment, and I made a little bit more. Let's say I made over $500,000. Well, not only am I going to pay the $202, but I'm going to pay income-related Medicare adjustment amount. It's called IRMAA, okay? And I'm going to pay an additional $487 per month on top of that. So my total Part B premium is going to be the $689.90 per month, okay? Now, you have a right to appeal that because maybe now I am retired. Maybe now I don't make that much money and I need to appeal it. I could definitely do that. You can request that by going to and filling out a form, SSA 44 form right here. You can get that online, or you can request that and we will email that to you. Okay. Something that I want to talk about here is how you work with brokers. Okay, this is pretty important. So I'm a Medicare broker. That means I sell multiple or educate and help people enroll with multiple plans. So let's say you look on your Medicare.gov and there's all different companies. I represent most all those companies. We are required to tell you that we don't represent all companies and plans, to go to Medicare.gov or call 1-800-MEDICARE for all your plans, but we're going to represent the plans that we feel are adequate for you, that your doctor takes, that your pharmacy takes, and that you are comfortable with. So when you're working with a broker, there is no fee for our services. People say, how do you get paid? Well, we get paid if we help you enroll in a plan, an insurance plan, and that company will pay us a commission. But if we work with you for 10 hours and we don't get your business, we don't get paid. That's okay, because we're here to help you, and that's the main important part that we're trying to accomplish. But when talking about requesting reconsideration, there could be a death of a spouse, marriage, divorce, maybe you stopped working, that's the big one, okay, involuntary loss of income, loss of pension, and all you have to do is you can call 1-800-772-1213, which is the Social Security office. We can send you the local Social Security office's phone number, or we fill that form out and we have you hand deliver that and talk to an agent at your Social Security office to try to offset those premiums. Now, if you have an appeal and let's say your first time you don't get an opportunity and they say, no, you're going to pay that amount, and you don't agree with them. We don't have to agree with them all the time. Well, if your request is denied, then you can still allowed to go and it rights to an appeal at the Social Security office. If you still don't feel like they've taken your ability to say, hey, I don't agree with this, you have the rights to take it to the Office of Medicare Hearing and Appeals. You can also take it to the Medicare Appeals Council, and you can also take it all the way to the Federal District Court. Make sure you're doing it within the first 60 days of that appeal or that denial, all right? And other things we do for you as brokers is we offer you advice to guide you through this. We offer you, at McGirl Insurance, what we'll do is we'll help you apply for Medicare. We'll help you apply for low-income subsidy. Sometimes people need Medicaid. We'll help you with that. And we'll help you all the way get your Medicare card. After enrolling in Medicare A and B, because that's our first step, right? We have to have A and B. Then we have different scenarios. In these 7 scenarios, you're going to find yourself, if you don't have Medicare yet, you're going to find yourself in here. Scenario 1, I'm 65, ready to retire. 62, I'm 65, still working, not ready to retire. Scenario 3 is I'm under 65 on disability. And then scenario 4 is I'm over 65, ready to retire. That's a good feeling. Scenario 5, I missed it. Oh no, you missed Medicare Part B. Now penalties are happening. Not going to happen to you guys because I'm going to help you through that process, and you watch my video. So scenario 6, I'm retiring with an HSA. HSA is a health savings account. People might still be working, want to continue to contribute to an HSA. If you do, you may need to make sure you don't apply for Part A. We'll get into that. And then scenario 7, I'm retiring with TRICARE. TRICARE is something like VA veterans benefits, a retired military. We're going to get into that. I have a brother who's retired military. He's not 65 yet, so he's only on TRICARE, but when you turn 65, you go on something called TRICARE for life. Scenario 1, when I'm 65, retired or retiring, I'm aging in. So it's the most common way to enroll in Medicare. It's something you use called IEP, initial election period or initial enrollment period. And in between that enrollment period, you have 7-month window. So you have 3 months prior, the month of, and 3 months after to apply for Medicare Parts A and B. Okay, that's the time where you won't have any penalties or waiting periods or anything like that, and you can get your coverage. Now, how do we do that? Well, there's a few different ways you can. We help people through that process, so we can go online for you and apply for you, where you get a letter in the mail saying, Alan McGirl from McGirl Insurance applied for Medicare. Do you agree? You sign off on it. I think you have to provide them with a copy of your driver's license, or I would usually take it in because they probably want your original, and I'd have them take it in and make a copy for you. You can visit your local Social Security office and have them help you. You can call Social Security, which we know that's really kind of difficult these days, or you can apply online yourself. If you have an SSA.gov login, you may apply. So there's so many different options and opportunities for you to apply for Medicaid. Now, scenario 2, I'm turning 65, still working and do not want to retire. Okay, that sounds like a lot of us these days. Now here's the caveat, make sure you understand whether your company has more or less than 20 employees. So in this slide, it says if my employer has less than 20 employees, then Medicare is primary. Medicare pays before your group health coverage. So if you work for a company like mine, we have less than 10 employees and you're turning 65, you're going to need to obtain Medicare A and B before the employer plan will pick up. Now we may find that it might be better to get off the employer plan, may not be. Just we have to do the math to figure that out, what works best for you. Okay, but we would use this, and we should use your initial election period for that. When you do that, you should sign up for A and B when you're first eligible at the initial period. So do that if your employer has less than 20 employees. Now, what if my employer has more than 20 employees? Well, at that point, you keep the employer plan. You have the right to take Medicare Part A, which is hospitalization, no charge if you work 10 years and paid FICA taxes. But if you're taking an HSA or contributing to HSA, then you do not want to do that, okay? Now, if you have a company that has more than 20 employees, the decision's on you whether you want to take Medicare at that time. Many individuals enroll in Part A, but they won't enroll in Part B because Part B costs you money, and you might not want to pay that. The company plan pays first, Medicare will pay second. So you sometimes don't want to take Part B, you want to delay that. And you can definitely delay that in those situations, and we can find a way to get your Medicare Part B when you're deciding you're ready to retire and go back on to Medicare, and we can help you with those forms. We'll show you that in a different slide, okay? And delaying Part B, you can delay that if you'd like. If you're receiving Social Security benefits for 4 months or longer when you turn 65, then you're automatically going to get your Medicare Part B card. So you may have to send it back, okay, if you don't want Part B. So we'll have to do that. There's another form that we fill out for you, and we'll send it in with you to help you through that, or we can email it to you and have that for you. You can see our email, you can touch base, you can click below to book an appointment. We can always help you through this process. Make sure you consult your employee benefit handbook. Make sure you understand what you're going to get into, and talk to a Medicare advisor. Scenario 3, I'm under 65. I'm on disability, ready to take out Medicare. Now, if I'm under 65 and I have a disability or illness, which means I'm on Social Security disability, on my 25th month is when I'm going to get my Medicare card. At that point, I'm going to have those same rights to apply for Medicare 3 months before, the month of, and 3 months after for a Medicare plan, okay? So in this scenario, I'm over 65, ready to retire. Woohoo! You did it. You get to work. You don't have to work anymore. You get Medicare, and we're going to work on what your options are. So in this scenario, we discuss retiree benefits. Some of you may have retiree benefits. Some of you may have COBRA, no coverage, and looking to enroll in Medicare. So in this case scenario, you will have a special election period to, it's called SEP, to apply for Medicare A and or B, okay? Now COBRA, some people say, well, I can take COBRA. They're going to give me COBRA, but COBRA is very expensive if you don't know that. When you find out, you'll say, oh, I want a Medicare. Now, if they're willing to pay for your COBRA, that's another thing, but COBRA is not deemed credible coverage. So if you go more than 8 months and more than 12 months, then you could be having a penalty on your Medicare Part B. I do not recommend you going on COBRA just because of the cost that you're going to get with original Medicare and a Medicare plan that we're going to show you here in a minute, okay? Most retirees will get A and B, Medicare will be primary, and retiree benefits are secondary. So if you're working for the state or a government, maybe TRICARE, Medicare pays first, TRICARE pays second, the retiree company pays second. Now, a lot of people say, well, I'm retired at 62 and my retiree benefits covered me. Well, when you turn 65, you're now eligible for Medicare, so it switches over. Please talk to your employer, HR department. It's super important that you understand once you turn 65, then Medicare becomes primary. And then at that point, your retiree plan becomes secondary instead of primary, okay? Even though it was over 20 employees, so keep that in mind. And again, COBRA is not deemed credible coverage. Always speak with your benefits manager for plan specifics. I'm over 65, ready to retire. How does it work? How do I get Part B? I didn't have it. People talk about these penalties. What's this all about? Well, we're going to guide you through this, because if you worked and you quit your job, you have 8 months to get Medicare Part B without any penalties. Now, if you were past your amount of time, let's say you're 67, yes, you can get Part B, but they're going to try to prove that you have to prove that you had credible coverage from when you were 65 years old. So how do you do that? Well, you have to fill out a form. This form is called the CMS L564 form. It's a request for employer information. This form is a form that you fill out the top page. Your employer fills up the second section saying, yes, he's been employed, or this person's been employed before 65. They've had credible coverage. They'll ask for the start date of your employment, start date for your health insurance, and it has to go back to your 65th birthday. So sometimes people will work for more than one company after 65. You're going to have to get those forms filled out by each employer. So if you're going to fly around different companies after 65, if you leave a company, get this form filled out so you don't have to worry about it later. Great advice. Once you have these forms, if you don't have these forms and you can't find the employer, you have a right to use your W-2s, your pay stubs, your 1095B forms. I know we have those now, and explanation of benefits paid by the group health plan, some sort of statement or receipts that showed you had coverage. But the form is the easiest way to get it. Now, you can fax those forms in. The best way to do it is to go to ssa.gov. Now, we help people with that. I did that this morning for someone, and it was a really simple process. I had those two forms. The 40B form is another form that says I want Medicare Part B to start at a certain date. Okay? And then the L564 is obviously the employer form. We will help upload those forms with you onto the Social Security site, and then about 4 weeks later, you'll get your new Medicare card with your Part A and Part B on it. Now, scenario 5, this is going to be for somebody who did not come to my webinar or come to my meetings and said, what did I do? Oh my gosh. So I missed signing up for Part B, and I need to enroll in a general enrollment period, the GEP, the general enrollment period. All these different acronyms, I don't know, I'm trying to keep them straight. I know we try it forever, but 30 years, I think I got it. All right, decline. So you declined when you're first eligible you declined your Part B when you're first eligible, but you didn't have credible coverage. Now I tell you what, I want to pick on my dad, but that's him. He was going to not take it because he didn't want to pay the money. I'm healthy, a farm guy, I don't do this. And I was like, Dad, you have to do it. So I convinced him how to do it. I helped him do it, actually. And we got him Medicare, so he has no penalty. But some people will miss that. Or sometimes you cancel it because you're like, I don't want this anymore. And then without insurance, and you would like to re-enroll, okay? And it's mid-year. Well, guess what? You can't just pick it up anytime you want unless you have a life-changing event. Most likely you'll pay a Part B late enrollment penalty unless you have something called low-income subsidy, which comes from the federal government for being a low income. Now, to enroll in Part B, you have to use the general enrollment period, which is between January 1st and March 31st. Whenever you apply, if I apply in January, it's going to be effective February 1st. If I apply in February, it's going to be March 1st and March to April, of course. So the coverage start date's the month after you sign up, if you didn't do it within your 8 months. So this is the, oh no, what happened? Why did I do this? Why am I paying this 10% penalty for the rest of my life? Okay, and that's 10% for every 12 months you miss. So if you miss 3 years, that's 30%. And that's a lot of money that you're spending. So be careful on when you enroll. Okay. Scenario 6, I'm retiring with TRICARE. TRICARE is a federal program for our military, active duty, service members, and most important, you must enroll in Part A and B, because Medicare's primary, TRICARE's secondary. So how it works is Medicare's going to pay first, TRICARE's going to pick up the rest. Okay. So we want to make sure, we want to check with your benefits advisor, check with TRICARE, but I know for a fact my mother was on TRICARE for life. My brother's on TRICARE now until he turns 65. And if that's you, thank you for your service. Really appreciate it. You deserve all those benefits you get. Scenario 7, okay, I'm retiring with an HSA. What's an HSA? It's a health savings account. So a health savings account is tied together with a major medical high deductible health plan. And with that, you have the ability to go to a financial institution and pick up an HSA where you can contribute up to like a certain amount of money, whether it's $4,100 or $8,300, whatever that number is every year, it changes. You can put money into an account for that rainy day if something happens. Now, I do have a little quick story, and I hate doing stories during my webinars, but tell you what, I had a lot of money in my account, and my kid broke his arm, I broke my hand, and then braces came and wiped me out. But what the whole point is when you have an HSA, you want to make sure if you're continuing to contribute to your HSA over 65, then you are not allowed to have Medicare Part A. So they don't have to have Part A. People say, you have to have Part A, you get penalized. That is not correct. You can continue to contribute to your HSA, but you cannot have Part A, okay? So, but when you do enroll for Part A and B, you cannot contribute to your, no longer contribute to your pre-tax dollars to your HSA, okay? You may continue to withdraw the money from your HSA tax-free to help you pay for medical expenses, including Part A, B, D premiums, your Medicare Advantage premiums, your co-pays, your co-insurance, your dental, your vision, your hearing, all those kind of benefits which your HSA can continue to contribute to. All right, delaying Medicare enrollment past 65, continue contributing to your HSA depends on circumstances. Remember, if it's less than 20 employees, you have to have Medicare A and B, stop paying into your HSA. If you have more than 20 employees, you can definitely not take your Part A, but what happens is when you go apply for Medicare, the government will backdate your Part A 6 months. So make sure if you're going to apply for July 1st, for example, they're going to backdate your Part A to January 1st. That means you have no contributions for this year. So do not contribute to your HSA. Now, so if I want to do it in January, they're going to backdate it to July, and I'm only able to contribute to 50% of that money into my HSA. So keep that in mind when applying for your health Medicare. Now we talk about extra coverage. Now we're getting into the plans. Okay, I'm going to switch over here a little bit and write out some stuff. Hopefully not too bad at chicken scratch, but we're going to make sure that you hopefully understand what we're doing here. Once you have Medicare Part A and B, then we move into plans. Why do I need extra coverage? Well, Medicare was never meant to pay 100%. Medicare generally pays 80% of coverage, leaving you with 20% co-insurance. There's no max out of pocket. So if I had a really bad year and I had $1 million claim, I could be out up to $200,000. There's no prescription coverage, and there's no ancillary benefits. So we'll talk about ancillaries, dental, vision, hearing, that sort of thing. Now, the first package we put together for folks is the one that's been around since 1965, is Medicare Supplement Plans, also known as Medigap policies, okay? Somebody says, I have Medicare Gap, and somebody says, I have Medicare Supplement. It's the same thing. Okay? It's the same terminology there. So anyways, we have original Medicare. We're going to focus on a Medicare Supplement plan and a Part D coverage because Medicare Supplements do not include prescription drugs. Now, when having a Medicare Supplement plan, they're offered by private insurance companies. They are standardized. So if somebody says, well, I have Plan G, and they say, I'm paying $190. And this person says, I have Plan G and I'm paying $300. Well, Plan G is the same no matter what company you go with. It kind of depends on the strength and stability of the company. Could depend on where you live. Could depend on how old you are. Not everybody's going to have the same price. Okay? But the plan itself is going to pay the same. Okay? Where original Medicare pays this, the plan pays secondary. And so when we look at this, some people call it alphabet soup, and the most popular plan today is Plan G. It's the most comprehensive plan. So if you're looking for the plan that has probably the most comprehensive coverage, I would say let's look at Plan G. What can I get out of that? Well, I can go to any doctor, any hospital in the whole United States. As long as they take Medicare, they'll take my plan. Okay? And with Plan G, I don't have any kind of coverage. I don't have any exposure for myself if I'm hospitalized. But if I go to the doctor, I'm going to have a small $283 deductible. And then after that, I'm done paying for the year. Now, it's calendar year. Okay, it's not, I turned 65 and it's lasts me for a year. No, it starts over in January. Okay, you must be enrolled in A and B. You must reside in the state you're buying the plan in. So just because Wyoming has cheaper plans, you don't live there, you can't buy a Wyoming plan. You have to buy a Colorado plan if you're living in Colorado. Age 65 and under, some states do not offer Medicare supplements, but some states do. You'd have to check with your certain state. Little plug here, I'm licensed in over 41 states, and if you're in a state that I'm not licensed in, just let me know and I'd be happy to get licensed in that for you and guide you through those products. Enrollment, guaranteed right to enroll during your initial enrollment period. That means they will not ask you any health questions. Now, coverage can be subject to underwriting if denied or if I missed during my initial election period. When's my initial election period? Well, I have 3 months before, the month of, 5 months after. It says 6 months, but I included the month of, then 5 months after. So if I have a bad disability or sickness or chronic illness, I can purchase one of these. They will not ask any health questions. Now, if I go past that on the 7th month, then they're going to look at, depending on what state you're in, there's 11 states that are guarantee issue. I'm not going to go through those. Look us up, ask us in the chat or send us an email or book an appointment to talk to one of our people in our office that are licensed and certified to help you. But we can check into that, whether your state is a guarantee issue state or not. If you're not in a guarantee state like Colorado, then you would be fully underwritten. So they'll ask you health questions, and you could be declined based on your health history. So make sure you make the right decision. Make sure you find somebody you can trust. At the end of the day, this is a lifetime decision that you're going to make, and you want to make sure it's a good decision for you and your family. So you may also pay a higher premium if it's available with those carriers. Now, Medicare supplement costs must pay into Part B. You've got to have Part B. Premiums vary based on the plan insurance. I got ahead of myself because it talks about why one company is more expensive than the other. It kind of depends on the carrier itself, and then more comprehensive coverage, the higher the premium. So we talked about Plan G being the top carrier, top plan, I should say, and then say Plan A might be the least comprehensive, or K or something. So we'll look into that for you. Now, the coverage, it does help pay for out-of-pocket costs for A and B. The coverage is standardized between those carriers, as we mentioned. The pros, here's the pros. It's excellent coverage. I can go see any doctor in the hospital, any hospital in the whole United States. I don't need referrals, prior authorization, or pre-approvals. I have a large network of doctors and hospitals. Now here's they say cons, but they're high premiums that continue to rise every year. So make sure when you're budgeting your Medicare premiums, I would budget anywhere from 10 to 20% every year. That's what we're looking at. These are the trends in 2025, 26 that we've been seeing. It does not have any ancillary benefits, so we don't have prescription drugs, we don't have dental, vision, hearing, or any of those extra little benefits that you might receive on, say, an Advantage plan. It could be underwritten if you miss your initial election period. Prescription drugs are not included, but those are the cons. Now, if I purchase a Medicare supplement plan, we talk about that, and I'm gonna pull out my pen here and kind of show you on this board a little bit about it. So when I talk about original Medicare, a package 1 is Medicare Supplement, okay? Or what do we call it? A GAP, right? Medigap plan, right? Then you have to, and we'll just say Plan G. Or N is the next best plan, and we can go over those benefits when you reach out to us. Then we need Part D. You have to have drug coverage for drugs. RX, right? How do we do that? Well, they're offered by private insurance companies. They can be purchased on a Part D, or they're going to be included in your Part C, which is Medicare Advantage. We'll get into those in a minute. There could be penalties for late enrollment. So when you turn 65, you're still working, and you get on Medicare, once you purchase a Medicare prescription drug plan, you're going to get a letter from the carrier saying, hey, we see that you didn't have coverage back till you're 65. Well, you're going to have to pick up the phone or fill out the form and say, I had coverage with so-and-so XYZ company and I'm covered. You must be enrolled in Part A or B, and you must live in the service area. Now, when it comes to Medicare prescription drug plans, Part D, they base it on state availability. So if I live in Colorado, I have to have a Colorado plan. If I live in Wyoming, I have to have a Wyoming plan. If I move and change my address with Social Security, I'm going to get booted out of that plan I had in Colorado. Let's say I want to move to Florida. And then I'll have to buy a Florida plan. So that's why we're in all these states, because we have a ton of clients that we've been helping for over 30 years, and they love us so much that obviously we help them when they move. Remember we talked about IRMAA and Part B premiums, and I was a higher wage earner. I sold a house or sold something, and I was making more money. Well, not only am I going to pay extra for Part B, as in a boy, for the health side or medical side, I'm going to pay extra for Part D. I'll pay an extra $91 if I'm over here. Now, just to give you a heads up, that's the numbers that's there. Prescription drug plans. So it's not automatic unless you're on Medicaid or low-income subsidy. Can be delayed past 65 if you're working and have credible coverage, which we talked about. Normally, you'd enroll during your initial election period, and that would be the 3 months before, the month of, and 3 months after. If you missed it during initial election period, you can still buy it during your annual enrollment period between October 15th and December 7th, but you may have a small penalty. We're going to talk about that penalty. You could be delayed due to enrollment with retirement and have a special enrollment period. This begins after employment ends, and usually you get a 60-day gap before they start penalizing you. Now, we talk about the penalty. The penalty is the extra amount added. Now, the penalty is 1% per month of the national average cost of prescription drug plan. The national average cost for a prescription drug plan is $38.99. So your 1% would be 38 cents, okay, per month that you miss. So if I miss 10 months, it'd be $3.89 per month for the rest of my life. And if that average cost goes up, so does my penalty. So don't do that. It's not going to happen to you because you watched our webinar here, okay? So congratulations on that part. So you can avoid that and enroll in your Part D prescription when your initial enrollment period is, or don't go 63 days without it, and make sure you call us so we can help you through that process. We'll guide you through Medicare.gov. We'll guide you through your doctors, your hospitals, your prescriptions, your pharmacies, and we'll make an educated decision on what's best for you. All right, something you need to check every year. Okay, formularies change. So we talk about people with formularies. Now, if you have a Part D late enrollment penalty, you can fight it. It's not a fun situation, so make sure when you get the letter, you answer the letter, or it might take 8 months to get that penalty off your record. Now, we talk about tiers. So if you heard about Medicare tiers, if you're on a drug, you probably know if it's a Tier 1 or Tier 5. Most commonly, low-cost drugs are Tier 1s. Those are the preferred generic, then the brand name, non-preferred generic drugs, then the preferred brand name drugs, non-preferred brand name drugs, and then your specialty drugs. The lower the tier, the lower the cost. The higher the tier, the higher the cost. Okay, each plan has a formulary. Inside that formulary are those tiers. Every company has to take 2 drugs from every therapeutic category to make their tier, and the cost may be different. This is kind of neat because I've been doing this so long that they used to have something called the donut hole or coverage gap. Now, I love keeping the donut hole in here because at this time I'm usually getting hungry and want to eat something, but I'll try to get through this. Hopefully you can too. But guess what? As of last year, 2025, they got rid of the donut hole. So no more donut hole. I don't have to waste an extra 10 minutes of your life to try to explain it. Okay? What it means is that your max out of pocket will never go more than $2,100. $2,100 max out of pocket. So basically, once you hit that $2,100, you're done paying for the year. And that's your deductible, that's your co-pays, your co-insurance, everything, as long as those drugs are in the formulary, you hit the max out of pocket. If you're going to get a drug from Canada, Canadian Meds or something like that, or GoodRx, that does not go towards your max out of pocket, so be careful on that. Now, we talk about low income subsidies. Some people have low income, okay? Maybe they're making less than this individually on a monthly basis, or as a couple, and then they have less assets than this. So if you make less than this and you have less than this in your assets, you qualify for something called extra help. It's low income subsidy. And this is something we provide. We will go to ssa.gov/prescription help, apply for you. It takes about 10 to 15 minutes. And then in about 3 weeks, you'll get a letter saying, hey, you qualify, or yes, you don't qualify. What's that going to do for you? Well, now you don't have huge deductibles on your Part D. It may help you pay for your Medicare Part B, and it's going to get rid of any kind of penalties that you might have had or anything like that. And then that really expensive drug that was costing you $200 a month won't cost more than $12 to $13 a month. Now Part C, so package 1 is original Medicare, Part A and B, Medicare Supplement, Part D, but you still need dental, vision, hearing. Have you reviewed your heart attack, stroke policy, your cancer policy? We package those together, so something you should think about, because if you have a heart attack or a stroke and you need extra coverage that Medicare doesn't cover, that's an extra way to help offset those costs. And if you know somebody that's had a heart attack, stroke, or cancer, you know there's additional costs that insurance doesn't cover. So we ask that you look at these plans, or at least review the ones you have. You may already have one. So now we're going to get into the third column, which I also call my package number 2 of Medicare Advantage. Now, Medicare Advantage plans include Part D. So we're going to have an HMO. We're going to talk about those. We're going to talk about PPOs, or HMO point of service, okay? And we're going to talk about CSNPs, okay? We're going to talk about those different options. Now, they do include Part D. They include Part D, so it's included prescription drugs. Now, the cool part about these are, where am I at? Single plan offered by a private insurance company. Did you like that? I could spin around. Shh. Ow! Hurts my ankle. I'm kidding. So anyways, I got to kid myself. Am I going crazy here yet? Anyway, so single plan offered by private insurance companies that combine your A and B. So you no longer have original Medicare. It goes over here on that $202.90 that you're paying, 90, goes over here. On top of that, original Medicare is paying a subsidized plan, okay, subsidized plan, and that could be anywhere from $800 to $2,500 per month based on your health. Okay, we don't know what that number is. They do those numbers, but then these Medicare Advantage plans have premiums of $0. Up to, depending on your state, it could have costs to these plans. I don't know what those plans are. We have to find out where you're at, what county you're in, because with Medicare Advantage plans, they talk about counties. So we're going to find your county. You book your appointment. We'll find out the plans that are available in your area. We'll guide you through that, all right? These are subject to prior authorization. So HMOs and PPOs usually might need a referral. You need prioritization, need pre-approvals, and these plans will be changed every year. A little bit, they might or might not. You'll get an annual notice of changes in the month of September, and then between October 1st and December 7th is when you can shop your plans, and you can actually make changes between October 15th and December 7th. Now, most of them have a zero premium cost. Medical services are broke down into co-pays, okay, or co-insurance. Plans have limit on max out-of-pockets. So they may say, okay, well, you have a max out-of-pocket. It is $5,100. I don't know, $5,900, $3,000. Who knows what that number is? Again, we have to find out your plan in your area. But you must continue to pay your Part B premium. See how I made that? You got to pay that no matter what. Don't think you can cancel your Part B. Must be enrolled in A and B, must live in the service area, which is your county. So if you're in one county and then you move over to the next county, you find out that you told Medicare you moved, and they don't offer that plan in your county anymore, you're going to get disenrolled from that plan, and you're going to have to re-enroll in a new plan. You'll actually go back to original Medicare, and you'll have an opportunity to buy a Medicare supplement, guarantee issue. All right, Medicare Advantage plans, it's not enrollment is not automatic. It can be delayed past 65 if you're working and have credible coverage. We talked about that. Normally you'd enroll during your initial enrollment period or when you're coming off your group or have that special enrollment period. Late enrollment penalty, if you miss during your initial election period, you have to wait to your annual enrollment period between October 15th and December 7th. Another thing is if you wait and come off of a group or marriage or divorce or something like that, you can come off during a special enrollment period, also known, or if you move, you can have that. And the last thing is, let's say I made a change and I didn't like it, or I made a phone call, or I did it myself. The first 90 days, in January to March 31st, if you feel like you messed up and you found out your doctor doesn't take the plan you chose, somebody called you and signed you up with a plan that doesn't fit your needs, you have a one-time trial period to switch your plan during an open enrollment period between January 1st, March 31st for an effective date the next month. Now, plan must cover all medically necessary services under Medicare. It has to be equal to or better than Medicare. Coverage is usually limited to a service area, so unless it's an emergency. So you just can't go wherever you want. Like original Medicare, I go see any doctor, any hospital in the United States. With these HMOs and PPOs, you have to go to a network doctor. So if you're under 65 and you're on a traditional health insurance program, I'm sure you have a network of doctors you go to, right? I'm assuming that, yes. Must obtain care from contracted providers unless emergency. So you have worldwide coverage for emergency for these plans and urgent care. May offer additional benefits such as dental, vision, hearing, over-the-counter silver sneakers, Meals on Wheels. Those are all additional benefits you get. So it's very important that you speak to somebody that knows what plans are available and what options are going to be best for you. But I tell you what, when I look at it, I want to make sure I have your doctor, your pharmacy, your prescriptions, and all your specialists covered, and your hospitals. So might not be the plan that gives you everything, but it's going to give you a plan that fits your needs. And that's what we do. We make sure we help you with the right plan. So keep that in mind when you're out searching for a plan. Now we have these HMOs and PPOs. Those are going to be your most popular. HMOs are health maintenance organizations that you go see a doctor, generally get a referral to a specialist and pay a small predictable copay. And you have prior authorization, maybe pre-approvals for some facility stuff. So preferred provider organization, PPOs, those are plans that allow you to have in-network and out-of-network benefits, usually have higher copays, higher out-of-pockets, and PPOs generally do not have any referrals, but they are subject to prior authorization and pre-approvals. Special needs plans, I talk about C-SNP plans, chronic special needs plans, people with diabetes, chronic heart failure, maybe D-SNP plans, people with dual plans, which it means you have Medicare and Medicaid. So if you have Medicare and Medicaid, you're going to get a plan that has a more rich plan that has lower copays, lower out-of-pockets, if any, and probably more benefits that we talk about. The health maintenance organization, HMO point of service, sometimes just allows you to not have a referral or maybe some out-of-network benefits on their dental or something. Private fee-for-services are plans where if you go to see the doctor, you have to ask the doctor if they take your plan every time you go. Okay, and they're willing to build a plan. And so it differs by network and your dual eligibility, talking about dual Medicare plans. Now the pros of these Medicare plans is they have a zero cost. I've been helping Medicare Part C plans since 2007 when they allowed brokers like myself to sell those products. Now those plans are Part C plans and they've had a zero premium plan since 2007. So you don't have that rate increase. They have a max out of pocket, so you know, worst case scenario, I know what I'm going to be out if something happens. Did I buy my heart attack and stroke and cancer plan? Because that's what's going to hit my max out of pocket. And if you don't have one, then ask us, we'll quote you one, and we'll help you make sure you have the full package for yourself. And I take this and go over here. This all goes over here, included or not. There might be a cost for some things, but at least you're going to cover your package and make sure you're covered for yourself. Now, extra benefits, those are all those extra benefits, including Part D. Here's the cons: network. What happens? Well, my insurance company or my doctor's office dropped the insurance company, or my insurance company dropped the network. What do I have to do? I have to change my plan. So I can change my plan when? During October 15th and December 7th. Additional resources: Medicare.gov, 1-800-Medicare, SocialSecurity.gov, Road Retirement. You can go to the Office of Personnel Management. The best person you can probably talk to today is me, Alan McGirl, McGirl Insurance. Been helping people for over 31 years. I want to thank you. If you have time, you want to leave a comment. If you'd like to set up a time to talk to me or one of my teammates, I can definitely do that. Click below. You're going to be able to click my calendar, talk to somebody. We will help you. I really appreciate the opportunity to spend with you today. Thank you so much, and have a wonderful day.